Welcome to the lecture on the foot and ankle ligaments and connective tissue investments. The arches of the foot are formed by the tarsals and metatarsal bones of the foot. There are two longitudinal arches and one transverse arch. The arches are reinforced by the muscles, tendons, and ligaments of the foot. The medial longitudinal arch includes the bones of the calcaneus, talus, navicular, the three cuneiform bones, and metatarsals 1 through 3. The lateral longitudinal arch includes the bones of the calcaneus, cuboid, and metatarsals 4 and 5. When the longitudinal arches are compromised, we often refer to this as being flat-footed. The transverse arch is composed of the three cuneiform bones, the cuboid, and the bases of metatarsals 1 through 5. Now let's talk about the ligaments of the medial ankle in the hind foot region. The ligaments reinforce the joint capsule of the ankle. On the medial aspect of the ankle in the hind foot region is the deltoid ligament. This ligament limits eversion. It is made up of 4 ligaments. The anterior tibio-talar ligament goes from the anterior aspect of the tibia to the talus. The posterior tibio-talar ligament goes from the posterior aspect of the tibia to the talus. The tibio-calcaneal ligament goes from the tibia to the calcaneus, and the tibio-navicular ligament goes from the tibia to the navicular. Pause the lecture to draw in the 4 ligaments of the deltoid ligament on the medial aspect of the ankle. How does your drawing compare? On my drawing, the anterior tibio-talar ligament is in green, the posterior tibio-talar ligament is in blue, the tibio-calcaneal ligament is in red, and the tibio-navicular ligament is in purple. There are 3 ligaments of the lateral ankle located in the hind foot region. These include the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. All 3 of these ligaments limit inversion. These ligaments are what you would most often see involved with lateral ankle sprains. Pause the lecture to draw in the 3 ligaments of the lateral ankle. The anterior talofibular ligament goes from the talus to the fibula. The calcaneofibular ligament goes from the calcaneus to the fibula. And the posterior talofibular ligament goes from the talus to the fibula. How does your drawing compare? In my drawing, the anterior talofibular ligament is in green, the calcaneofibular ligament is in red, and the posterior talofibular ligament is in blue. The foot ligaments include 3 ligaments that support the arches and the plantar aponeurosis. Note you will not be tested on these ligaments other than the plantar aponeurosis, but you will likely need to know these for another class. The spring ligament, also known as the plantar calcaneonavicular ligament, is a thick band of connective tissue that goes from the calcaneus to the navicular. The short plantar ligament, also known as the plantar calcaneal cuboid ligament, is a short, wide band of connective tissue that goes from the calcaneus to the cuboid. The long plantar ligament attaches to the calcaneus, goes to the cuboid, and also to the 2nd, 3rd, and 4th metatarsals. The plantar aponeurosis is also known as the plantar fascia. It is attached to the tuberosity of the calcaneus and extends to the phalanges of digits 1 through 5. Inflammation of this structure is known as plantar fasciitis. Pause the lecture to draw in the plantar aponeurosis from a medial view. How does your drawing compare? Now pause the lecture to draw in the long plantar ligament as well as the plantar aponeurosis. Know that the long plantar ligament is deep to the plantar aponeurosis. Both structures attach to the calcaneus. How does your drawing compare? In this drawing, the long plantar ligament is in green, whereas the plantar aponeurosis is drawn in purple. Now let's talk about the retinacula of the foot. Retinacula, by definition, is a structure that maintains another structure in place. Retinacula is plural, whereas retinaculum is singular. All of the long tendons of the ankle are covered by retinacula. The tendons are also enclosed in a synovial sheath to reduce friction. The tendons to the plantar aspect of the foot must pass either medially or laterally around the tuberosity of the calcaneus. The flexor and the extensor retinacula are extensions of the deep fascia of the leg. The flexor retinaculum is located on the medial aspect of the foot and ankle. It goes from the calcaneus to the medial malleolus. It holds the tendons of the tibialis posterior, flexor digitorum longus, and flexor hallucis longus in place, as well as the tibial nerve. The extensor retinaculum has two parts, an anterior part that goes over the anterior aspect of the ankle, and an inferior part that goes over the dorsum of the foot. The extensor retinaculum helps to hold the extensor tendons and the tendons of fibularis longus and brevis in place. The following are links that have good resources for studying not only structures of the foot, but in particular the flexor and extensor retinaculae. Shin splints, also known as medial tibial stress syndrome or soleus syndrome, is when there is overload to the lower leg. This you can see often in people who have a sudden increase in their physical activity, especially running programs, or in athletes that begin training programs where they increase their intensity and frequency of training abruptly. The soleus and its fascia form a tough bridge over the deep compartment of the posterior leg. The soleus also, one of its main functions, is to help to prevent excessive pronation of the foot. Therefore, stress of the soleus and its fascia, particularly when pronated, results in inflammation on the periosteum along the posterior medial border of the tibia. If the soleus muscle is weak or being overworked, overcompensation with other muscles occur on the anterior aspect of the leg, resulting also in contribution to the anterior shin pain. Tarsal tunnel syndrome involves the compression of the posterior tibial artery and nerve as it passes through the tarsal tunnel behind the medial malleolus. It is analogous to carpal tunnel syndrome, where the median nerve is compressed as it courses through the carpal tunnel. Tarsal tunnel syndrome is often delayed in diagnosis, as its symptoms include pain, numbness, and tingling into the foot, which can be similar or confused with other things such as peripheral neuropathy, rheumatoid arthritis, diabetes, swelling, or even lumbar radiculopathy. Treatment of tarsal tunnel syndrome has poorer results than treatment for carpal tunnel syndrome.